Today I'm going to speak about the transmission of respiratory viruses and therefore of COVID-19 and how this actually takes place. In the first place, let's look at the respiratory system because when people are infected with COVID, the virus is present in high concentration in the nose, throat, and if the lungs are affected, lungs of the patients. When they cough and when they splutter and when they blow their noses, this virus then lands in the air around them, and these droplets can actually settle on any surface from which it can then be transmitted. With a regular cough, if one covers your nose and mouth, the droplets can spread up to 2 meters. And when one coughs really loudly and when one is singing, the droplets can spread as far as 4.5 to 6 meters from where a person is standing. So this explains to us why it is so necessary to have a mask on, because the mask will prevent the droplets from getting into the air and therefore arriving at other people. When we are without masks, we need a distance of at least 4.5 meters between ourselves and the other people to prevent the transmission of the virus. The virus also lands on surfaces, and when one has a cold, a study was done in the United States, and a regular porter in a hospital and an infectious diseases physician were both injected with fluorescent dye. Now, one expected that the infectious diseases physician would not be that contaminated by comparison to the porter, not because of any other factor, but because he is supposed to know better how to prevent transmission. At the end of the day, both were put into an ultraviolet room, and it was found that there were secretions and the effects of the secretions from the top of the head up to the knees in both cases, and also down the arms to the fingertips on both sides. Obviously, the back of the patients were less affected. So this illustrates that the virus lands on surfaces everywhere, and that when one touches these surfaces, the virus can actually transmit to other people. This tells us why sanitization of the hands, sanitization of surfaces, and social distancing are so tremendously important. So you can understand that this tells us why the governments in the world have implemented the rules that they have implemented. The rules are, in the first instance, when that you should cover your face and nose with a mask so that the droplets will be caught up in the mask and not disseminate. At the same time, wearing a mask protects one against the droplets that come from other people. The virus that comes from surfaces, when one touches the surfaces and then touches one's face, one's nose, one's mouth, you can actually transmit the virus to yourself. And this explains why the surface contact is so important, why we should sanitize our hands, sanitize surfaces. Singing and talking, the virus can spread for periods, the droplets can spread for distances of 4.5 and even 6 meters. And therefore, it is important to keep at least this distance when one is speaking or singing without a mask. And therefore, it is so imperative that in a church where singing is going on, people need to be at least 4.5 meters from each other if they're not wearing masks. Otherwise, they need to be at 2 meter distances from each other.